Welcome to my lesson on congestive heart failure. The goals and outcomes of this class are to provide increased understanding of congestive heart failure diagnostics, medications used to treat congestive heart failure, and offer an insight of understanding on the patient education needed in congestive heart failure. Students will become more versed in their knowledge base and be able to provide needed patient education upon completion of this training. So what is congestive heart failure? Congestive heart failure, often referred to as CHF, is a progressive chronic cardiac condition that occurs when the heart cannot pump systolically or fill diastolically adequately. The progression of CHF inhibits cardiac function of the heart by causing blood to flow back into the lungs or the vascular system. What are the most common causes of CHF? The most common causes of CHF include coronary artery disease, cardiomyopathy, myocarditis, heart valve dysfunction, high blood pressure, and pulmonary disease. In order to determine if a patient has CHF, they must first undergo certain diagnostic procedures. What are the diagnostic procedures to determine if a patient has CHF? One type of diagnostic test for CHF is called a BNP, or a B-type natriuretic peptide, also known as a brain natriuretic peptide. This is a hormone secreted by the cardiac muscles in response to any sort of cardiac damage, and it can be collected or can be determined through blood samples. Another diagnostic that can be used is an echocardiogram or a nuclear medicine stress test. These are the most common procedures in determining CHF in patients. These diagnostic procedures would measure the patient's ejection fraction, or EF. A patient's EF is the measured percent of blood that the heart pumps each time it beats. In the determination of CHF, nurses need to know that a normal EF is anywhere between 55 and 65% or greater. How would we know if our patients are having acute exacerbations of CHF, and what are the signs of CHF? Symptoms of CHF are based on which side of the heart is damaged. The left side of the heart brings oxygen blood from the lungs through the left atrium to the left ventricle, then out into the body. When the left side of your heart is damaged or can't pump as well, it has to work harder to send blood through the body. Cardiac function reduction causes fluid to build up in your body, especially the lungs. That's why shortness of breath is one of the most common symptoms of left-sided heart failure. With left-sided heart failure, nurses will see symptoms that affect the pulmonary system, such as dyspnea, tachypnea, crackles in the lungs, dry hacking cough, and paroxysmal nocturnal dyspnea. The right side of the heart usually becomes weaker in response to the failure on the left side. The right side of the heart brings in the circulating blood from the body and sends it to the lungs for oxygen. When the left side of the heart weakens, the right side of the heart has to work harder to compensate. As the heart muscle loses strength, blood and fluid come back up in the body. With right-sided heart failure, the patient will exhibit symptoms that affect the circulatory system. These symptoms would include dependent edema, jugular vein distension, abdominal distension, splenomegaly, anorexia, nausea, and weight gain. Even though CHF is not reversible, it can be treated and managed with specific medications. Some of the most common medications used to treat CHF include diuretics. The most common diuretics include hydrochlorothiazide, chlorothiazide, furosemide, bumetanide, spirolactone, and torsemide. These medications work by causing an increase in renal function to remove more sodium and water from the bloodstream than usual. This effect then creates less fluid volume, thus decreasing the workload on the heart. The results of diuretics can be seen through a decrease in fluid volume in the lungs and reduction of edema in the extremities. The side effects of diuretics can be significant, as they can cause a drop in potassium levels and dehydration. Angiotensin-converting enzymes, or ACE, inhibitors are also commonly used in CHF treatment. Common ACE inhibitors include catepril, enalapril, ramipril, lisinopril, and quinapril. ACE inhibitors work by blocking the conversion of angiotensin-1 to angiotensin-2. Angiotensin-2 is a potent vasoconstrictor and can increase a patient's blood pressure. This increase in blood pressure then increases the workload on the heart, causing an increase in cardiac stress. ACE inhibitors block the effect of hormones that make the heart work harder, thus creating a decrease in blood pressure. The most common side effects of ACE inhibitors include dizziness from low blood pressure, dry cough, and less commonly, angioedema or swelling of the lips, tongue, and throat. Digitalis preparations can also be used to treat CHF. The most common Digitalis preparation is digoxin. Digoxin increases the force of the heart's contractions while simultaneously slowing the heart rate. The effects of this medication cause a decreased workload on the heart. This reduction in workload causes the heartbeat to be stronger while diminishing the symptoms of CHF. Some noted side effects of digoxin include nausea, vomiting, blurred or abnormally colored vision, palpitations, or a marked slow heart rate that may lead to dizziness or blackouts. Beta blockers are another medication used to treat CHF. Beta blockers block the beta receptors on the heart, which when stimulated make the heart rate increase. Common beta blockers include carvedilol, metoprolol, atenolol, labetalol, and propranolol. The increase in heart rate is the body's way to compensate for a failing heart. These increases in the heart's workload can subsequently worsen heart failure. The most common side effects include feeling tired and dizzy. Angiotensin II receptor blockers, or ARBs, block the effects of angiotensin II on the cardiovascular system, thus causing a reduction in vasoconstriction. Common ARBs include losartan and valsartan. The action of ARBs are very similar to those in ACE inhibitors. ARBs block the effects of stress hormones on the cardiovascular system. The final medications in the treatment of CHF are vasodilators. Vasodilators cause the blood vessels to relax in the heart. The relaxation effect then causes a decreased afterload, thus improving blood flow while reducing cardiac workload. The most common vasodilators are isosorbide, hydralazine, and nitrates. It's important to remember that patients placed on new medications will need initial and ongoing education to manage their CHF. Patients need to be instructed on the importance of medication compliance in the treatment of heart failure. Some patients may require multiple medications to maintain the disease process, and many of these drugs may be initiated during hospitalization. These medications require continuous monitoring for effectiveness and may need to be changed according to how the patient responds to them. Patient education should include all adverse side effects that may come along with these new medications that they take, along with when to call the physician. Patients need to call their healthcare provider if they have side effects from medications, gain 2 pounds or more in a day, or 5 pounds or more in a week, have an increase in swelling in their ankles or legs, have any shortness of breath, dizziness, nausea, vomiting, or a dry hacking cough. If a patient is struggling to breathe with new onset symptoms or chest pain, they need to be instructed to call 911 for emergency assistance. Since we've established that patient education is so important, understanding certain words for patients is also important. As an in-class activity, I would like the students in this class to now pause this video and look at the list of words below. These words are paroxysmal nocturnal dyspnea, orthopnea, dyspnea on exertion, anorexia, and lower extremity edema. I want the students to put these words into layman's terms and discuss amongst themselves better ways to explain these to patients. Here is a list of possible answers to those words and how to explain them to patients. As a final assignment, students will use the information from the presentation as a reference tool to fill in the crossword puzzle that's going to be provided. The assignment will be done after the training session and returned back to the facilitator after completion. Here's an example of the crossword puzzle that's the assignment. And this is a list of the answer keys so that you know that you got your answers right. Understanding the aspects of congestive heart failure are very important to all nurses. I hope you've enjoyed this training session. Thank you.